To perform a concussion evaluation, let's say that I cover a basketball tournament and one of the athletes tried to grab the ball and collide with another athlete, so in the rebound, and go to the floor. I enter and do my primary assessment, check level of consciousness, stabilize the spine until I rule out, check airway, breathing, and circulation. If the patient is unconscious, I can ask questions. Do you have any central pain, tingling numbness on your arm or legs? I can do sensation and motor function. So can you feel me here, here, and down to your legs? And then motor function, start with gas pedal, and can you squeeze my hand? Ask question about where we are, what is the score, what is the team that we are playing right now. Then if the patient is fine with all of that, I can zero straight and move to secondary assessment on the sideline. Also observe for any disorientation, balances difficulties, confusion, and at this point I see if the patient is alert, verbalize, open the eyes, how is the grip and the motor function and sensation, and I can document with the glaucoma scale. Well, if the patient is at least out of the game and sit at the bench, wait for the game just finish, and I'm going to check him every 5 minutes if it's good, ask question, and then I can I should talk with the parents. It is a minor or is adult or people that can oversee, that coach or someone, until that the athlete probably has a concussion, and said everything about any symptom increases. You have to take him to the hospital, and all the follow-up questions and red flags the patient has to be aware. Then if the patients at the next day come to the training room to do the SCAT 5. Well, we are going to start with the SCAT 5 with the athlete background. Sport.
Basketball.
Year of education completed.
Senior.
Age.
22.
Dominant hand.
Right.
How many diagnosed concussions do you have in the past?
1.
When was the most recent concussion?
Like 6 months ago.
How long was the recovery? How long you get clear to go back to the
2 or 3 months.
Hospitalized for head injury?
No.
Diagnosed or treated for headache disorder, migraines?
No.
Diagnosed with a learning disability, dyslexia?
No.
Diagnosed with ADD or ADHD?
No.
Diagnosed with depression, anxiety, or the psychiatric disorder?
No.
Do you intake medications?
No.
I'm going to give you this symptom evaluation. I need you to feel. So none is just you don't have any, and 6 is severe. He get done the symptom evaluation, so move on to cognitive screening. What month it is?
July.
What is the day today?
July 14.
What is the day of the week?
Tuesday.
What year it is?
2020.
What time it is right now? Within 1 hour.
Like 8.
Okay, so I'm going to give you a words, and you have to repeat back to me at any order. Okay? Elbow, apple, carpet, saddle, bubble.
Elbow, apple, carpet, saddle, bubble.
Okay? 2 more times. Elbow, apple, carpet, saddle, bubble.
Elbow, carpet, apple, saddle, bubble.
Elbow, apple, carpet, saddle, bubble.
Elbow, apple, carpet, saddle, bubble.
Okay? I'm going to read a string of numbers, and when I'm done, you repeat them back to me in reverse order of how I read them to you. For example, if I say 719, you would say 917. 493,
394,
415,
514,
3481,
1843,
376519,
9 1 7 5 3.
Okay. Now tell me the month of the year in reverse order.
December, November, October, September, August, July, June, May, April, March, February, January.
Okay. Let's move on to neurological screen. Can you read this loud to me? Let me find the. Can you read this for me?
Only that word or the whole
The whole row.
dollar, honey, meter, saddle, anchor.
Can you move your neck up and down and side to side?
Yes.
So you have to follow this without your move your. You have to follow this with your eyes without move your head or neck. Well, test your coordination. So please sit up straight, comfortable, and with arm on the side, how to stretch, and try to touch your tip of the nose with your index finger. Good. Now, can you stand up for me? And you have to walk in a straight line and put heel to toe. Well, I'm going to test your balance. So please stand with your feet together and put your hands on your hips with your eye closed. And you have to stand and maintain your stability in that position for 20 seconds. Good. The next balance test is the single leg stance. So if you are going to play soccer, which leg you are going to use if you kick the ball?
The right.
The right? Okay. Where you stand on your left and lift your right leg and put your hands on your hips and close your eyes and maintain the position for 20 seconds. Good. Well, the last one is a tandem stance. So you are going to put your non-dominant leg on your back and put your hands on your hips and close your eyes. And maintain the position for 20 seconds. Good. Okay. Do you remember the list that I gave you? The words? So tell me as many words as you remember in any order.
Subtle.
Okay. After we collect all the information, we have to analyze and make the decision if the athletes had a concussion. But we can use the SCAT as alone method for diagnose concussion. We have to combine with physician clearance, arrest and recovery, and a sport return progression. Yeah, we have to make a baseline for every athlete that we have, and if one of them has a concussion, we have to do this again for post-injury. Yeah, we have to monitor all the athletes that get concussed and document how many concussion they had about the entire life or in the year, especially with football. That is one of the main sport that every time the athlete get concussed. Yeah, we have to advise the coaches and parents about symptoms and what the athlete can do and cannot. Yeah, that is pretty much the SCAT 5. Evaluate all the functionals, step, neurological function, cognitive function, and balance function. And after we get all of that, we consult with the physicians to make a better background for the athletes and make good decisions and monitor the athletes every time if they get well or worse.